Ever wondered what really goes on behind the scenes? When a company says it's certified for safety.
Ah, right. Yeah, it sounds impressive, but what does it actually mean day to day?
Exactly. It's way more than just a piece of paper, isn't it? It's supposed to
Yeah.
be this ongoing commitment.
A living commitment, ideally, to keeping people safe.
And sometimes let's say, the real story of that commitment, where things are working well and maybe where they're not quite there yet, that often comes out during an audit.
That's where the rubber meets the road, definitely. Audits hold up a mirror.
Precisely. So today, we're doing one of our deep dives. We're jumping into the world of occupational health and safety audits, OHS audits.
Good stuff. Always important.
And we're looking at a really concrete example, an internal audit simulation. It's based on ISO 45001.201.
The big international standard for OHS management systems.
Yeah. And the company is, let's call them ABC Manufacturing LLC, fictional name, but based on real scenarios.
Got it. A case study approach.
Exactly. Our mission here is to basically pull apart what the auditors found.
Okay.
Understand what those findings mean, and see how a company like this actually stacks up against those global safety standards.
So not just the theory, but the practice.
Right. So you, listening, you're not just going to get a definition of what an audit is. We want you to get a real insight into what happens when things aren't, well, perfect.
Which, let's be honest, is often the case. No system's flawless.
True. And crucially, how companies can use these deep dives, these audits, to actually get better, to improve.
That continuous improvement cycle, that's the whole point.
Think of this as like a blueprint, a way to understand those real-world challenges and how safety management evolves. Okay, let's unpack this.
All right, let's do it.
So first things first, let's set the stage properly. These details really matter for understanding the context.
Absolutely. Where, what, who?
Okay, so ABC Manufacturing LLC, where are they? Dubai, UAE.
Okay, international context.
Yep. And what do? They manufacture industrial cabinets, the kind used for power systems, automation control panels, that sort of thing.
Right, so definitely an industrial setting, not just an office. We're talking machinery, processes, potential hazards.
Exactly. And it's not a tiny outfit either, about 50 staff members.
Okay, decent size. Mix of roles, I imagine.
Yeah, skilled operators, engineers, support staff, people interacting with machinery, chemicals potentially. You get the picture.
Definitely. Lots of moving parts, literally and figuratively.
And here's a key point. ABC Manufacturing, they are already certified to ISO 45001.201 team.
Ah, okay, so this isn't their first rodeo. They've been through the certification process before.
Correct. This specific audit we're dissecting, it's their annual internal OHS audit.
Right. Maintaining the system, not just getting the initial certificate. That's a crucial difference.
It really is.
Yeah.
It grounds our deep dive in that ongoing reality of keeping the standards up day in, day out.
It's not a one-and-done thing. Certification requires continuous effort and verification.
So yeah, it gives us this really concrete, real-world setting to look at compliance, but also that journey of improvement.
What's fascinating here, and maybe something folks outside the industry don't always grasp, is just that point. Even a certified company needs these regular checkups.
Like a regular health check for their safety system.
Exactly. And ISO 45001, just to remind everyone, it's the global benchmark for OHS management systems. It's all about having a structured way to manage risks.
Proactively, right. Not just reacting after something bad happens.
Precisely. It aims to help organizations prevent workplace injuries, protect physical and mental health, which is increasingly important,
Good point.
and really drive that continuous improvement of their safety performance.
So for a company like ABC Manufacturing, in that industrial space, this certification isn't just window dressing.
Oh, absolutely not, or at least it shouldn't be. It signals a serious commitment to their employees, to customers, to regulators. It says, we take safety seriously.
It's about embedding processes, not just having a policy gathering dust somewhere.
Right. Building resilience. Identifying and mitigating risks before they cause harm.
Okay, so this internal audit they were doing, what was the specific objective? What were they trying to achieve with it?
Well, like any good audit, the objectives were clearly laid out. It wasn't just, ticking boxes.
Hopefully not.
No. The main goal was, 1, evaluate their ongoing compliance with ISO 45001. Are they still meeting all those requirements?
Standard check.
Makes sense. 2, identify any gaps or weaknesses in their system. Where are the potential holes?
Okay, proactive searching for problems.
And 3, this is critical. assess the actual effectiveness of their safety practices. Do the things they have on paper actually work in reality on the shop floor?
The reality check, that's key.
Absolutely. And the scope where they looked was pretty comprehensive, too. It focused smartly on the higher risk areas.
Like what?
Well, the main shop floor, obviously, where the cabinets are actually being built.
Right.
The paint booth, that's a classic high-risk zone with chemical exposures.
Yeah, fumes, solvents.
Exactly. Also, their chemical storage areas, how are those managed?
Important. Segregation, labeling, access.
Precisely. And even employee welfare facilities, because safety and health extend there, too.
Interesting. So a broad scope looking at multiple potential failure points.
It tells you they weren't just skimming the surface. They understood that risk isn't confined to one spot. A failure in chemical storage could impact the shop floor, for example.
It's all connected. So who was actually doing this audit? The team.
Right. The team composition is also quite revealing. They have Zainab Al-Hashmi as the lead auditor.
Okay.
She's a certified ISO 45001 lead auditor. So she brings that deep knowledge of the standard, best practices, the objective viewpoint.
The expert eye.
Then they had Mohammed Rafiq as the internal auditor. Now, he's also the company's safety officer.
So he knows the place inside out. The day-to-day reality.
Exactly. That practical on-the-ground perspective is invaluable. He knows the processes, the people, the specific quirks of their operation.
A good combination, external standard knowledge and internal operational knowledge.
And there was one more person. The HR manager was there as an observer.
HR. Why HR?
Well, think about it. Safety has huge human resources implications, right? Training, competency, worker consultation, communication, disciplinary actions if needed. HR has a stake in ensuring the human element of the safety system is working.
That makes a lot of sense. So it's a mix of perspectives.
A really strong mix, I'd say. You've got the compliance expert, the operational expert, and someone focused on the people side. It ensures a holistic review, checking the paperwork and the reality of the process and the people.
It helps figure out if safety is truly embedded or if it's just, lip service.
Precisely. That's how you get beyond the surface level.
Okay, so we've got the scene set. We know ABC Manufacturing, the context of this internal ISO 4501 audit, the objectives, and the audit team.
Yep, the stage is set.
Now let's get to the juicy part. What did Zainab, Mohammed, and the HR observer actually find?
The findings. This is where it gets interesting.
This is where, as you said, the rubber meets the road, where policies meet reality. Sometimes those realities can be a bit messy.
Or just different from what's written down. It happens all the time.
So what did they uncover when they started digging at ABC Manufacturing? This is where it gets really interesting. We're going to dive into specific clauses of the standard, the specific findings, and really unpack what they mean.
All right, let's start digging.
Okay, let's kick off with a really fundamental part of any good safety system. Clause 5.4, that's worker consultation and participation.
Ah, yes. Hugely important.
For anyone listening who deals with these standards, you know this is about really involving workers, right? Not just top-down directives.
Absolutely. It's about development, implementation, and importantly, improvement of the OHS system. It requires getting input from all levels.
Frontline workers included.
Especially frontline workers. It's not just informing them, it's actively seeking their participation, their ideas, their feedback on things that affect their safety.
Why is that involvement so critical?
Because fundamentally, the people doing the job day in, day out are the real experts on the risks they face.
Right. They see things management or engineers might miss from an office.
Exactly. They know the workarounds people use, the equipment quirks, the new misses that maybe don't get reported formally. Their input is invaluable intelligence for preventing accidents.
Like a built-in hazard detection system if you actually listen to them.
That's a great way to put it, an essential layer of intelligence.
So at ABC Manufacturing, what did the audit find regarding this clause?
Well, the finding was pretty direct. Through interviews with workers.
Talking to people on the floor.
Yes. It became clear that workers were not being regularly consulted specifically in risk assessment reviews.
Okay. So when they were looking at job hazards, they weren't routinely asking the people doing the jobs.
Apparently not consistently. And the evidence backed this up. The last documented consultation on risk assessments was 8 months ago.
8 months. Wow. That feels like a long time in a manufacturing environment.
It is a very long time. ISO 45001 stresses ongoing or continuous involvement. 8 months doesn't really fit that description, does it?
Not really, no. Things change too fast.
Precisely. Think about ABC manufacturing new orders might change production flow. Maybe they tweaked a process, new materials came in, maybe short-term staff were hired.
All potential sources of new or changed risks?
Exactly. And if you're not asking the people at the sharp end about these changes for 8 months, your risk assessments are likely getting outdated fast. You're missing that critical real-time intelligence.
It's like flying blind to some extent.
It really is. You might have a hazard control that worked 8 months ago, but maybe it's less effective now because something subtle has shifted in the process and only the operator notices it.
So how did the auditors classify this finding? What was the official term?
This was classified as a minor nonconformance, or minor NC.
Okay, minor nonconformance. What does that mean in audit speak? Is it serious?
It's serious enough, yes. A minor NC means there's a definite slip-up. A requirement of the standard isn't being fully met.
But it doesn't mean the whole system is broken.
Correct. It's not a major nonconformance, which would indicate a fundamental breakdown of the system or a high risk of failure. Think of a minor NC as a significant warning light.
Like the check engine light you mentioned earlier.
Exactly like that. The car still runs, the overall safety system at ABC is considered operational, but there's a clear problem that needs fixing. If you ignore it, it could lead to bigger problems down the line.
So the consultation process existed in some form, maybe, but wasn't happening properly or frequently enough.
That seems to be the implication. It wasn't systematic, continuous, or perhaps well-documented enough to meet the standard's expectations.
And what are the potential ripple effects of that? Just outdated risk assessments?
Oh, it goes much deeper than just paperwork. If workers feel their input isn't valued, or that safety is just imposed on them.
They disengage?
Exactly. Engagement drops. They might be less likely to speak up about near misses or hazards they spot. They might not feel ownership over safety procedures.
It undermines the whole safety culture you're trying to build.
Absolutely. It becomes management's responsibility, not our responsibility. And you lose all that incredibly valuable ground-level knowledge. It's a missed opportunity for proactive safety improvement, pure and simple.
Yeah, that makes perfect sense. If you're not talking with people, you're missing half the picture, maybe more.
Easily.
Okay, so that was worker consultation. But what about when workers are, well, just unaware of the dangers right in front of them?
Ah, yes. That leads us nicely into the next finding.
This relates to Clause 7.3 of the standard, which is all about awareness.
Crucial. Absolutely crucial.
So what does this clause really demand from a company? What's a core requirement?
In essence, it requires that everyone working for the company, employees, contractors, even visitors to some extent, understand certain key things.
Like what?
They need to be aware of the company's OH&S policy, what their own role is in making the safety system work effectively.
So personal responsibility.
Yes. Also, the potential consequences for themselves and others if they don't follow the safety rules or procedures.
Understanding the why behind the rules.
Exactly. And critically, they must be aware of the specific hazards and risks related to their particular job and work area.
So knowing the dangers they actually face.
Precisely. It's about ensuring people know what to do, why it matters, and what could go wrong if they don't do it right.
Okay, so that's the standard. What did the audit find at ABC Manufacturing regarding awareness?
Well, this finding was, as you hinted, quite concerning. It came from the paint booth.
Which we already flagged as a high-risk area.
Right. So the auditors did some spot interviews with workers there, just talking to people doing the job.
Yeah.
And they found that 2 out of the 5 workers they spoke to were unaware of some pretty basic critical things.
Like what?
They didn't know the specific health effects of the chemical fumes they were breathing in every day.
Seriously, in a paint booth.
Seriously. And maybe even more alarmingly, they weren't clear on the function or even the location of the emergency showers.
Wow. Okay, that's not just a gap. That sounds like an immediate danger.
It absolutely is. Let's really break that down. Paint booth chemicals, those VOCs, volatile organic compounds.
Nasty stuff.
Very nasty. Acute exposure can cause dizziness, breathing problems, skin irritation, things that can lead directly to accidents right there and then.
Slipping, making mistakes.
Exactly. And long-term, chronic exposure, we're talking potential damage to lungs, liver, kidneys, nervous system, even cancer risks. This is serious health protection we're talking about.
So not knowing those risks is negligent. Almost.
It's a massive failure in awareness. And the emergency shower thing, that's equally critical if someone gets splashed with a corrosive chemical.
They need that shower immediately.
Within seconds.
Yeah.
Knowing where it is and how it works can be the difference between a quick rinse-off and a severe chemical burn, permanent scarring, or eye damage.
Seconds count. Literally.
Literally. So for any worker in that area to be unaware is a major red flag.
So how was this finding classified? Was it another minor nonconformance?
No, this one was classified differently. It was logged as an observation.
An observation.
Oh.
Okay. How does that differ from a nonconformance?
An observation points out a potential weakness or a deviation that could lead to a nonconformance or an incident if it's not addressed. It's not necessarily a direct violation of a specific shall requirement in the standard yet, but it highlights a clear area for improvement.
So it's like maybe the company has an awareness training program, but it clearly wasn't effective for these two workers.
That's a likely interpretation. The system component training might exist on paper, but this finding questions its effectiveness, its reach, or maybe its frequency. Perhaps these were newer employees who slipped through the cracks, or maybe the training itself wasn't engaging or clear enough.
It's like the worn tire analogy you used. Not flat yet, but definitely needs attention before it blows out.
Exactly. It's a serious warning sign about the implementation or verification of their awareness procedures.
What are the immediate implications of this finding?
Well, the most immediate implication is for those two workers, obviously. They are working in a high-risk environment without fully understanding the dangers or the emergency procedures. They are personally at much higher risk.
Right.
But it also points to a potential systemic issue. If 2 out of 5 interviewed were unaware, what about the others? What about workers in other high-risk areas?
Could be the tip of the iceberg.
It could be. And imagine an actual emergency, a chemical spill, a fire. If people don't know what to do or where the safety equipment is, it could lead to panic, incorrect actions, delayed response, making a bad situation much, much worse.
It puts everyone at risk, not just the unaware individual.
Precisely. It really hammers home the need for not just doing awareness training, but verifying that it's understood, especially for new hires, temporary staff, and anyone in those critical high-risk roles. It needs to be targeted, repeated, and checked for comprehension.
Not just a tick box exercise. Needs to stick.
Absolutely. It's about building that human resilience layer effectively.
Okay, so we've seen issues with getting worker input and ensuring worker awareness. What about tracking how well the safety system is actually performing overall?
That brings us to the third key finding, related to Clause 9.1, performance evaluation.
Right. For folks managing any kind of system, measurement is key. What does ISO 45001 expect here?
It's pretty comprehensive. The standard requires organizations to figure out what needs monitoring and measuring.
Identifying the right metrics.
Exactly. Key performance indicators, KPIs for safety. Then when to measure, how to measure, and critically, how to analyze and evaluate the data you collect.
So it's not just collecting numbers, it's using them.
Using them to understand performance, identify trends, see if your controls are working, and drive improvements. It's the feedback loop for the entire OHS system.
The engine for continuous improvement, like you said.
Precisely. Without measurement and evaluation, you're just guessing.
So at ABC Manufacturing, how are they doing on this front?
Well, here's where it gets interesting again. The audit found that they had actually defined OHS KPIs.
Okay, that's a positive. They knew what to measure.
It is a positive first step, absolutely. It shows they understood the need for metrics like maybe incident rates, near misreporting frequency, training completion rates, safety observations, things like that.
Standard safety KPIs.
Right. But the problem wasn't in defining them, it was in using them. The audit found that these KPIs were not being reviewed monthly, as their own procedure likely required.
Oh, how often were they reviewed?
Well, the last compiled KPI report the auditors could find was 5 months old.
5 months. Wow. So they had the data potentially, but weren't looking at it regularly.
Seems that way. Or at least not analyzing it and reporting on it in a timely fashion. 5 months is a long time to wait to see how your safety performance is trending.
Yeah, especially in manufacturing. That data is practically ancient history by then.
It really is. Why is monthly review so important? Because it lets you spot trends early. A slight increase in near misses in one department, a drop in safety observations, maybe a cluster of minor first aid cases.
Leading indicators. Things that might predict a bigger problem coming.
Exactly. Timely data allows you to see those signals and react before a major incident happens. If you're only looking every 5 months, you've missed the window for proactive intervention. You're purely reactive.
Driving by, looking only in the rearview mirror, way back.
That's the perfect analogy. You see the crash long after it happened, you don't see the conditions building up to it.
So how did the auditors classify this one? Nonconformance. Observation.
This was classified as an opportunity for improvement, or OFI.
Opportunity for improvement. Okay, another category. How is that different?
Then OFI is essentially a suggestion. It's not saying something is definitively non-compliant, like an NC, or necessarily a direct precursor to non-compliance, like an observation often is. It's saying, you have a system or process here, but it could be significantly better.
So the process for KPIs existed, but it wasn't being used effectively.
Exactly. The framework was there. They defined KPIs. But the execution, the frequency of review and analysis needed refinement to actually deliver its intended value. The auditors saw potential for ABC to get much more out of their own data.
You're doing okay, but you could be doing great here.
That's the essence of an OFI. It's about optimization and enhancement, rather than fixing something fundamentally broken or non-compliant.
What's the real impact of not reviewing that KPI data promptly?
The biggest impact is on decision-making. How can management make informed, data-driven decisions about where to focus safety efforts or resources if their data is 5 months old?
They can't, really. They're guessing.
Pretty much. They can't accurately track if safety initiatives are working. They might miss emerging risks. They can't effectively allocate training resources. They can't even properly celebrate successes if they don't have current data to show improvements.
It hinders that whole continuous improvement cycle we keep talking about.
It absolutely stalls it. Effective performance evaluation is the fuel for that engine. Stale data means the engine sputters or stops. They lose the predictive power of their own information.
Right. So 3 distinct findings: consultation gaps, awareness issues, and lagging performance reviews.
A minor NC, an observation, and an opportunity for improvement. A typical mix, actually.
So after digging into all of this, the consultation, the awareness, the performance tracking, but what was the final overall conclusion from the audit team about ABC Manufacturing's safety system?
Well, the auditors had to synthesize all these findings into an overall assessment.
Pass or fail? Or is it more complex?
It's almost always more nuanced than a simple pass-fail, especially with internal audits focused on improvement. Their conclusion was that the OHSMS management system at ABC Manufacturing was, and I quote, operational and broadly compliant with ISO 45001.2019.
Okay. Operational and broadly compliant. What does that really mean?
It means the core structure is there, it's working, they're meeting most of the requirements of the standard, so it's definitely not a failed system.
That's the good news.
That's the good news. It acknowledges the work they've already done to get certified and maintain it to that level. But
there's always a but.
There's usually a but. The conclusion also specifically stated that the system still required attention and strengthening in those areas we just discussed.
Worker consultation, awareness, and performance reviews.
Exactly. So compliant overall, but with specific identified weaknesses that need addressing to make it more robust and effective.
So to sum up the results clearly.
1 minor nonconformance related to worker consultation.
Okay.
1 observation regarding worker awareness in the paint booth.
Got it.
And 1 opportunity for improvement concerning the frequency of KPI reviews.
Clear, concise. It gives them a very specific roadmap, doesn't it?
Absolutely. It tells management exactly where to focus their improvement efforts. No ambiguity. It's not about tearing everything down. It's about targeted reinforcement.
Okay, so with that roadmap laid out, what does this actually mean for ABC Manufacturing going forward? We've got the findings, but the real value is in the action, right?
Exactly right. An audit report gathering dust on a shelf is useless.
So what concrete steps, what recommendations came out of this audit to address these specific issues?
The audit report included very specific recommendations directed at different levels of the company. These become the action plan.
Okay, like what?
Well, for top management, there was a clear mandate. They needed to ensure that formal consultation sessions with workers on OHS matters happened at least quarterly.
Quarterly. Okay, that directly tackles that 8-month gap we talked about.
Precisely. It puts a specific measurable frequency on it. It makes worker consultation a regular, expected part of the management rhythm, not just an afterthought.
Shows commitment from the top, too.
Which is crucial for culture change. It embeds that continuous involvement principle into practice.
Okay, what about the safety department? Mohammed Rafiq's area.
They got several key action items. First, they were directed to immediately resume monthly reviews of the OHS KPIs.
Directly addressing the opportunity for improvement. No more 5-month-old data.
Exactly. Get back to timely analysis. Use the data proactively. Turn it into intelligence, not just history.
Makes sense. What else for the safety department?
A big one, tying back to the paint booth observation. Ensure timely onboarding safety training for all new and temporary staff.
Closing that potential gap for newcomers.
Yes, making sure that from day one, people understand the specific risks of their job, especially in high-risk areas, and know the critical safety procedures and equipment.
Like those emergency showers.
Absolutely. Basic but vital stuff. This is fundamental risk reduction, preventing that awareness gap from happening again.
Anything else?
One more specific point, which sounds administrative but is really important for verification.
Okay.
Maintain training records within 7 days of an employee starting.
The documentation piece. Proof that the training happened.
Exactly. It ensures accountability. If there's ever an incident or during the next audit, they can quickly and clearly demonstrate that required training was completed and when. It closes the loop.
So connecting the dots. Each recommendation seems to tie directly back to a specific finding.
That's the hallmark of a good audit and action plan. It's not just generic advice. It's targeted corrective and preventive action. Quarterly consultation fixes the minor NC. Monthly KPI reviews address the OFI. Timely onboarding and record keeping address the observation on awareness.
It really shows that cycle in action. Audit finds issues, management sets specific actions, system improves.
That's the continuous improvement loop right there. Assess, act, measure the results, reassess. It's a dynamic process, not a static one. For the best companies, it never really stops.
Wow, that's been a really fascinating deep dive into how this actually works on the ground. We've seen ABC Manufacturing's internal audit play out.
From setting the stage to the specific findings.
Right, the minor nonconformities, the observation, the opportunity for improvement, understanding what those terms actually mean in practice.
And crucially, how they lead to concrete actions.
Exactly. And this, look at ABC Manufacturing, it's more than just about their specific business, isn't it?
No, absolutely. It's a microcosm.
It really illustrates how continuous improvement functions in almost any complex system, whether that's safety, quality, IT security, you name it.
The principles are transferable. Identify weaknesses, plan improvements, implement them, check if they worked.
It really underscores that idea that compliance or even excellence isn't a destination you just arrive at.
No, it's an ongoing journey. You've got to keep tending the garden, so to speak. Keep checking, keep refining.
Always room to get better, safer, more efficient.
Indeed. And, you know, the real value of these audits, internal or external, isn't really about catching people out or assigning blame.
It shouldn't be anyway.
And no, it shouldn't. The true value is in creating safer, better workplaces by shining that objective light on areas that need attention. It's proactive problem solving.
Building resilience by understanding your weaknesses.
Precisely. And the willingness of a company like ABC or any organization to actually do these audits honestly, to face the findings, and then, most importantly, to act on them, that's what really separates the leaders from the laggards.
It shows a genuine commitment, not just box ticking.
It fosters that culture where safety is everyone's job and learning from mistakes or weaknesses is normally, even encouraged. It turns risk from something scary and unknown into something manageable.
So as you, our listener, reflect on this case study from ABC Manufacturing, here's something to maybe think about.
A final thought.
Yeah. What surprising blind spots, what subtle weaknesses might exist in your own organization or your team, or even just in your personal work processes? Things you might be unaware of.
Turning the audit lens inward.
Exactly. How could a structured deep dive, even a simple self-assessment, help reveal them? Think about those key lessons from ABC. The importance of genuine participation, the need for constant awareness, the power of tracking performance properly.
How could those apply to your world?
Right. How can you use those principles, participation, awareness, measurement in your own context, whatever that is, to make sure your systems aren't just running, but are actually getting stronger, better, continuously improving?
The challenge is seeing your own operations with that objective auditor's eye.
It is.
Right.
But the opportunity is huge. Finding those areas for improvement before they become real problems, that's the goal.